Hello all my viewers, this is Terry the RN. Yeah, it's been a while. I've not made videos, but today I'm here to say hello to all my viewers and to talk about a topic of concern, which is hypertension, which is a condition that affects most of adults above 40. And we found that even at 30 years, some people have hypertension. When blood flow in your blood vessels is very high, you get hypertension. So when are you considered to have hypertension? When you go for checkup and your blood pressure is 140/90, you have hypertension. So when your blood pressure is 140/90, you need to be monitored closely by your doctor. Your doctor needs to check that blood pressure for some time just to monitor the trend. Maybe it can be reactionary, maybe you're reacting to some bad news. Or sometimes people, when they react to bad news, their pressure tends to go high. So your doctor needs to observe you for some time to ensure that he makes the right diagnosis. So when you have the high blood pressure, you started on antihypertensives. So it's very important for all of us to go for checkups. Yeah, you can plan to do your yearly checkup just to ensure that you're very healthy, your health is good, and that you're not developing some diseases are not coming up, and this will lead to complications. Hypertension leads to many complications like kidney failure. When the pressures are so high, sometimes you can get a bleed in your brain. An artery can burst due to the pressure of blood, and that gives you a stroke. So many patients who have suffered a stroke maybe have had hypertension which was not treated properly. So we need to be very vigilant. We need to go for checkup. Yeah, at some point we always are busy doing our work, going to work, doing our businesses, but we forget to go for checkup. If you go for checkup, you'll be diagnosed early, and you'll be managed accordingly. If you get kidney injury, you know you will have to be doing dialysis for like sessions in a week, which is very expensive and very demanding. Some people have even gone for kidney transplants. So we have to be very careful. Most of the people think that if you're diabetes is when you can get in kidney injury. Most patients get kidney injury because of hypertension. They get hypertension, they do not recognize the symptoms, and it ends up they end up getting kidney injury. So what are the signs and symptoms of hypertension? You have to be careful on yourself. You know when you're normal and when you're not okay. Sometimes patients get you feel dizzy sometimes, and sometimes patients complain of headache, throbbing headache. So if you have a headache that you cannot explain, just go check for your blood pressure, dizziness, blood vision. Sometimes you feel like a patient tells you, I can't see clearly. That is a sign of hypertension. So if your pressures are very high, you'll be weak, you'll not be able to work, you will be tired, you feel tired easily, you have the headache, you have discomfort. Make sure you see a doctor. You go for checkup, check your blood pressure. You can even have a blood pressure machine in your own house and do your checks and record. If you can do your BPs every morning and evening, you get the trend, and then you know that now this one I need to see a doctor. These machines are not very expensive. You can have a blood pressure machine in your house, and if you have elderly parents also, you can buy for them. We have electronic machines, so they're not the manual ones, which are difficult to use. For the electric ones, for the latest BP machines that we have, any person, even an elderly patient, can check their own blood pressure. So I just wanted to pass that information to you, my viewers, this evening, that you be careful, have time to go for checkup, for your own checkup, so that if you have any problems, if you have high blood pressure, you are diagnosed early, you start medications early to prevent complications. So I think if you have any questions about hypertension, how you can manage yourself, and who maybe you need to be referred to a good doctor, you can reach out to me. I am available. I can direct you. I can also teach you how to do your own blood pressure and do the recordings to ensure that you manage yourself well. We need to be healthy to be able to work. With this hard economy, most of the people are getting so stressed and that stress leads to hypertension. So manage yourself well, manage your issues well. If you're so stressed to a point that you cannot handle it, go see a psychologist to help you on how you're going to manage your stress. Some patients have hypertension not because of stress, but because of maybe it's in the family. There's a family history of hypertension. So if there's a family history of hypertension, just keep checking yourself, so that if you see your pressures are high, you start on your medications early. So I want to thank you all for being there for me, for watching my videos, for subscribing. We are growing, and I also want to tell you to put a comment, ask questions, ask as many questions as you can, so that you can understand yourself well. So my name again is Terry, the RN. Thank you many times for being there for me, for supporting me. So you can also give me a thanks. Just press the thanks button there and give me a thanks if you appreciate what I am teaching. And we will continue educating you here in this channel, so that we have a healthy nation. Bye bye.